Welcome back to Physio Capsule. Myself, Dr. Husna Hussain. I'm a physiotherapist. In this video, we are going to discuss about frozen shoulder. This condition can also be called as PA shoulder, that is periarthritic shoulder, or adhesive capsulitis. Basically, the condition is because of thickening and contractions of the joint capsule. It can happen because of idiopathic reasons or secondary to other conditions such as trauma, calcification, tendinitis, acute cervical spinal nerve pathologies. Those who have conditions such as diabetes or hypo or hyperthyroidism are more prone to develop frozen shoulder. This condition develops in three stages. Stage 1 is freezing period, or more correctly, it can be referred as pain dominant phase. Capsular thickening begins in this phase. Pain will be worst more commonly at night. This phase lasts for almost 6 months. The second phase is frozen stage. Here, the pain seems to reduce, but stiffness develops on the joint. This phase will also last for around 6 months. The last phase is called thawing phase. At this phase, the stiffness starts reducing on its own. This phase may last from 6 months to 1 year. The patients should be aware of the condition so that they can manage their expectations and set goals accordingly. Let's move to the next part, diagnosis. Age is an important factor. Normally, this condition is seen between the age of 40 and 60. That is, average is 50 years. Next factor is movement. Active and passive movements will show restrictions, especially at end line. We can feel a capsular pattern of restrictions in this condition, especially for external rotation. The ROM may be 10 degrees or less for external rotation. Another important factor in diagnosis is that there should not be crepitus in the joint while we palpate the movements. Even though the diagnosis is possible from clinical examinations alone, X-ray will be taken in order to rule out other possibilities. Let's move on to the last part of the video, that is management. As there are 3 stages for this condition, each phase has got different ways of management. In the pain dominant phase, the primary goal will be to reduce pain. Along with pain medications and pain modalities, simple exercises such as pendular exercises, shoulder ladder, and pulley exercises can be given in this phase. Passive mobilization will also be helpful. In the second phase, that is stiffness dominant phase, the pain medications and management can be continued. In order to manage the stiffness, stretching can be initiated. Stretching exercises should be focused on external rotation, capsular stretching, flexion capsular stretching, and internal rotation capsular stretching. As the pain comes down, these exercises will become more convenient in this phase. Manual therapy can be initiated, mainly focusing on external rotation. If improvement is not shown in this phase, other techniques such as hydrodistensions can be considered. In the last phase, that is recovery phase, the goal should be to achieve maximum movements so that some vigorous stretching exercises can be done in this phase. This include external rotation, sleeper stretch, internal rotation, sleeper stretch, etc. TheraBand exercises and other strengthening exercises can also be included in this phase. Thank you for watching the video. Stay connected.